Over 7 billion people call this place home. We're all vested in the health of this planet, and central to this is protecting the health of our planet's mothers, children, and families. Tragically, lack of access to family planning services results in the death of millions of women and children worldwide each year. Only about 1 in 5 African women have such access. 10 years ago, the Bill and Melinda Gates Foundation, in partnership with the Johns Hopkins Bloomberg School of Public Health, made a commitment to the people in the developing world to help stem the tide of infant and maternal mortality by helping to provide access to family planning services. The Bill and Melinda Gates Institute for Population and Reproductive Health was born under the founding director, Laurie Zabin. The Institute's current director, Amy Choi, professor of population, family, and reproductive health, describes conditions a decade ago in Africa.
In Nigeria, there has been progress. My first trip there was in 1987. You couldn't even utter the word family planning there. It was just a complete taboo topic. But now they just held their second National Family Planning Conference. 10 years ago, I never would have thought that would have been possible. In Ghana, things have changed. Definitely the management of fertility has gotten more efficient. There are multiple ways that women access. Both Ghana and Nigeria have recently committed millions of dollars into their budgets for purchasing commodities.
Mojisola Odeku, project director of the Nigerian Urban Reproductive Health Initiative, or NORI, says the grassroots effort in Nigeria began by involving the people who stood to benefit from family planning services right from the start.
The discovery period before you launch out with interventions is very key. On this project, we spent a year to do that. We also engaged different stakeholders as to what kind of message would they like to see for family planning. What is their perceived benefits? What are the challenges and what are the barriers? This went through the org of all stakeholders in the community level to the leadership, to religious leaders, and to policymakers.
The result was a robust, multi-pronged approach utilizing a uniquely African intervention, the talking drum, and songs composed to integrate the drum with family planning messaging.
There's a lot of need within the community, and yet the community is not aware of the services available in those facilities around them. So we have community members trained as community mobilizers. They go once a month into the community around the facilities that we work, simply to tell the community about the benefits of family planning. They use the local language and the local messaging. Traditionally, they like drumming. We have what we call the talking drum.
The talking drum is also supplemented with a weekly radio drama, Facebook page, text messaging, and other interventions to advise people about family planning benefits. At the University of Ibadan, Olandosu Ojenbede, professor of obstetrics and gynecology, says their outreach has been more effective when women are engaged in family planning services when they come to have their children immunized.
We see that every woman will want the child to survive, and so they go for child immunization services. They attend regularly. They are very committed to it. We feel that that should be the point at which we should introduce family planning to them, educate them, and give them the opportunity to choose. And if they then choose, we also offer the services so that it will be a one-stop to get everything.
Ojanbede and colleagues in Ibadan are also engaging men and religious leaders in family planning messaging.
Male participation and support for women to access family planning service is very, very important in sub-Saharan Africa. Many men are happy to support their wives when they are in labor, during delivery, and by seeing all of that, what the women go through seems to have encouraged the men to see the need for child spacing, for limiting family size, and for ensuring the good health of the women and the children, that it does also affect the total health of the family.
Isman Otupori, head of the Community Health Department at Kwame Nkrumah University of Science and Technology in Ghana, says the support of men, religious leaders, and political leaders is crucial in advancing the message of family planning.
The King's wife has pledged to be a family planning champion for the next decade. She has organized trips to all the various units of the kingdom where her husband is king, and she has a solid program to promote family planning at these cultural levels. She has, through us, arranged with the Ghana Health Service, so the Ghana Health Service will provide the service during these interactions.
Otupuri also identifies the partnership of Johns Hopkins and the formal educational opportunities it provides as pivotal in advancing the family planning agenda.
I think what has been most successful is the exchange of ideas that has culminated in us being more productive than we ever could have been. When you get in touch with top researchers like Emmy and the others at the Gates Institute, you can't fail to do well yourself. We also now have a perfect understanding of what it requires to do top-notch research and then to inform programs such that we can do that in our home countries and across the partnership.
One beneficiary of these educational opportunities is Funmi Ongongwi, an MD and graduate of the Masters in Public Health program at the Johns Hopkins Bloomberg School of Public Health. She is now practicing in Nigeria.
With my training as a doctor and my master's, I think I have like a double tool to help both in the clinical and the research aspect. With education, women are empowered. With women getting more interested in health, getting more interested in education and research, is a way one could give back to the community.
More utilization of family planning services, reduced maternal and infant mortality, improved educational opportunities by whatever metric. The Bill and Melinda Gates Institute for Population and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health has been a resounding success.
When I started my own career working in contraceptive research, I think the level of use in the world was around 17 to 18%, and now we're looking at all the millions of women in the world. It's up to 60%. That's a huge number of couples and users who found their way to manage their pregnancies, and the world has improved so much for it. Children are healthier, families are happier, couples are happier, so how can you be against family planning?